Multitasking is great in the kitchen when you are trying to time the chicken to be ready at the same time with the potatoes.
But do not assume this is a great way to start to manage a workload.
This is a quotation by
Joanne Dombracos.
Why Not Multitasking?
Well, if you want to ensure a positive outcome involving your client's care, you must focus on one task at a time. You might think this is impossible to do, but there are alternatives that we will show you how to achieve this.
I am Michelle.
And I'm Marta.
Today we will talk about some of the advantages and disadvantages of meeting multiple needs and demands of the clients.
We will see how following some simple steps will help you to achieve your job successfully. Welcome
to our presentation. You, as a healthcare assistant, are busy every day providing clients with the best care possible. You do everything from toileting, dressing, feeding, managing others, helping these clients to live better and have a healthier lives.
You do all of this with quality and compassion. Meeting multiple clients' needs and demands is one of the challenges that healthcare assistants face every day. You might be wondering how you can manage all these responsibilities and yet doing it with quality and compassion.
Some of the advantages are working as a team. You share responsibilities to reduce your workload, improves your job efficiency. You get to know clients more than the other healthcare providers like nurses or doctors. Rewarding to know that you are doing all you can to provide the best quality of care. Develop self-discipline, ability to have control and motivate yourself, stay on track and do what is right.
Some of the disadvantages are it could be very stressful. Feeling frustrated for not being able to respond immediately to all demands. You might be working by yourself at times. Limited time to perform the task. Difficulty meeting with all the physical, emotional, and social health needs of the clients. Healthcare assistants are required to respond to many needs and demands of the clients. It may not be possible to respond immediately to all demands, so as a healthcare assistant, you should be able to prioritize clients' needs and manage your time. You must be flexible, diplomatic, consistent, and competent. Effective organizational and communication skills are essential.
Being flexible. Share job responsibilities, ability to adapt, modify your response to clients' needs and co-workers' needs.
Being diplomatic. Mutual respect between coworkers is essential. You are willing to stand up for your interest and express your feelings, but you are also aware of others' rights and willing to solve conflict.
Being consistent. Have a routine that best works for you and your client. Try not to make many changes as this may confuse the client.
Being competent. Identify the skills that you have as well as the skills that you want to build. For example, you might be great with communication skills and keep updating your coworkers with the client's needs, but you are challenged to manage organizational skills.
Communication skills. Effective communication between coworkers in healthcare settings is essential to provide good quality care to clients. Also, when you communicate with clients, keep it clear and simple so they can understand what you are saying.
Organizational skills. By being well organized, the risk of making mistakes decreases. You save time and effort.
Prioritize by importance and urgency. Ask yourself, is it urgent or not urgent? Is it important or not important? Think before you act.
Information on this slide gives you an idea how to prioritize by knowing the difference between what is important, not important,
Urgent, not urgent. Think.
anything important and urgent, get it done now. Anything important and not urgent, plan into a schedule. Anything not important and urgent needs to be done quickly or ask for help. Anything not important and not urgent, do it last.
Self-care. The role of the HCA is not easy when the day flies with many responsibilities and tasks. You need to know that your job is very important and that you can be successful.
Taking care of yourself is extremely important. Have plenty of rest when your body needs it. By doing so, you will build resilience that will help you manage stressful and difficult situations. Make self-care a priority. By taking care of yourself, you will be able to take care of others, providing the best quality of care.
Ethical issue.
Negligence and malpractice. Negligence and malpractice. So, we just learned that some of the healthcare assistants' responsibilities is to respond to the needs and demands of the clients, and at times it might not be possible to respond to all needs. What about when you try hard to do your job and something goes wrong anyways?
Let's say that you are assisting someone on bed who is soiled. Then you hear the call bell. Is another client calling for help, saying that cannot wait any longer to go to the bathroom. You just finished care with your first client and rush to the other client's call, but you forgot to raise the bed rails when the care plan states to do so, and the client falls off bed.
You feel terrible about the situation because you did not mean it. However, your act is considered as negligence. You had good intentions, it was unintentional, but your actions were careless, and you caused harm to a client.
We will show what negligence is, some factors that cause negligence, how the HCA Code of Ethics can help you to make good conscious decisions. Also, we will see what is the meaning of malpractice. What is negligence?
Negligence is a failure to act in a careful manner, resulting in harm to a person or damage of property. Causes of negligence.
Not performing a task or procedure correctly.
An example is, you forgot to check the water temperature for the client's bath. The client is burned.
Performing a task or procedure that you are not qualified to do.
An example is, there is a new mechanical lift in the facility and you assume you can handle it like the other ones. So, you transfer a client when you realize you don't know how to bring down the lift. Your client is screaming because he doesn't want to be up in the air anymore.
Making a mistake because of carelessness that causes harm to a client or his or her property.
An example is, you are cleaning the client's dentures, you drop them and they break. How can you avoid getting into these situations?
Remember the Healthcare Assistants Code of Ethics.
Healthcare assistants provide high-quality personal care and support services. They work within their scope of practice.
Healthcare assistants need to be aware of the policies and procedures for each area.
Healthcare assistants provide compassionate care to all clients.
Healthcare assistants value the dignity and worth of all clients.
Healthcare assistants respect clients' choices about how they receive care.
Negligence.
It is an unintentional mistake that results from a worker's careless act.
Malpractice.
It is a type of negligence. It occurs when a licensed professional, like doctors or nurses, act recklessly and intentionally, knowing that it could harm a person.
A good ethical conduct will guide you to make good decisions when you face difficult situations. Remember, as a healthcare assistant, you advocate in promoting the client's dignity, independence, preferences, privacy, and safety.